This is Eye on Health on Dubai Eye 103.8
with MedLab Middle East.
I'm Helen Farmer. You are listening to Eye on Health here on Dubai Eye 103.8, brought to you by Arab Health and MedLab Middle East. Today we're talking about immunology and kidneys and personalised medicine. So much happening actually behind the scenes that we as patients probably have absolutely no idea about. Joining us now is Dr. Marilyn Karam, consultant allergist and clinical immunologist at the Saudi German Hospital. What a fascinating job you must have, Marilyn, especially over the last few years. What's keeping you busy there at Saudi German when it comes to allergies? I mean, immunology at this time of year. What's coming into clinic?
So it is definitely quite an amazing field. Allergy immunology is considered the baby in medicine, really. It's been there for only 100 years versus like centuries for cardiology or other specialties. In terms of the most common allergic and immunological diseases that I see, those include like nasal allergies, respiratory allergies such as asthma, and I do see quite a lot of urticaria, which means like skin rashes, and yes, definitely food allergies as well.
Sometimes it must be so hard for people to actually figure out the root cause of, as you say, wheezing or a rash or tightening of throat. So you must be a bit of a detective, I think.
Absolutely, and that's why really I love my job. It's actually, lots of things can trigger you and can trigger your immune system, be it an allergen or even like an irritant. So anything can trigger your immune system and lead to symptoms. And it's quite, intriguing to actually find out the answer for our symptoms.
I mean, fascinating for you as a doctor, but I'm sure life-changing for your patients as well, for them to be able to understand maybe what they need to avoid moving forward, help them navigate the world that's going to keep them safe. And it's a really interesting time at the minute. We've been talking about precision medicine on the show today. So how does that apply to your field, to allergy and immunology?
Yeah, well, precision medicine, when we talk about precision medicine, it's really taking into account every individual as such. So we used to practice medicine as a one size fits all. But that no longer holds true. So we have to take into consideration one's genetics, the environment, the exposures that he or she are subject to. So definitely precision medicine guides our management, and there's also tailored therapy. So the more advances we have nowadays, we can target specific proteins or steps in our immune system that can help manage different patients with the same condition. Let's say, for example, asthma.
Well, I was about to ask you that. Would you mind giving us an example of what that could actually look like, just for people listening today? Because it can feel a bit abstract. You're there
Absolutely.
in the white coat. So would you mind explaining, kind of walking us through what this approach can actually look like for a patient?
Absolutely. So let's talk about asthma, and that's the most commonly studied entity in precision medicine. So when we talk about asthma, there's several different types. There's people who have asthma that's triggered by certain allergies, so they get their attacks only when they're exposed to dust or cats or dogs. There's people who have ongoing exacerbations with no reason. But there's also another category who are triggered by only viral illnesses. So they only get their asthma attacks when they get sick. So each and every one example that I gave has a different molecular pathway that in the immune system that has led to these symptoms or susceptibility. And so from our end, we can target these patients differently using different medications depending on the pathway that was triggered. So we would use different medications to treat them, although they all have asthma and have the asthma exacerbation. But because of this subtle variation in presentation and triggers, then we can use more targeted therapy to see more benefit.
Dr. Marilyn, what about even a step before that, getting to that preventative piece with genetic testing? What role do you think that might have when it comes to allergies and immunology issues as well?
Absolutely. So this is like a very important subject, specifically in allergy and the immunology part as well. So we now, with all the scientific research, we've identified certain genetic mutations that actually have a higher likelihood to develop a certain disease. So people with this, let's say, mutation X, have a milder disease. Mutation Y, they have more severe disease. And but it's important also, as we there's a fine line that we don't want to step. We don't want to create a lot of anxiety also. Mm-hmm. Not everyone with a specific mutation will develop a disease. It just increases your susceptibility. You may live your whole life without actually developing a disease. So we are getting there. There's a lot of talk about genetics helping us doctor guide the treatment for patients. But that holds true only for certain specific conditions.
Mm-hmm. Yeah, I think that's a really good point in terms of that balance. An awful lot of people having health anxiety, and whether it's genetic testing, in utero or in little ones. We want to be treating the symptoms, not necessarily being too proactive. But what about some of the other challenges and opportunities that perhaps implementing precision medicine might have? What are you excited about, or is there anything you're feeling a bit fearful about, Dr. Marilyn?
This precision medicine requires a lot of attention and increased awareness among us doctors as well. We do need to shift from the view that this is a one size fits all to really individualize therapy for our patients, and that takes time. Time with the patient. You need to listen very carefully to what they're actually saying. Oh no, you can't really discard anything that you're saying. Exactly. They're saying, because
you've got to look at that whole body and that whole picture, because, as you say, something that might seem seemingly normal, and people get used to living with discomfort, with pain, and just thinking, oh, it's just part and parcel. It's who I am. It's part of getting older. It's part of living here. It's, all of these things. But as you're saying, if you're listening to the small things, then that can add up to a really powerful, impactful, big picture that then you can start to treat. So taking up that really detailed history must be crucial, and family history as well. My goodness, when we're talking about genetics in particular. For people listening today, Dr. Marilyn, who might be suffering with allergies or intolerances, reactive skin, seasonal issues, what's your first point of call? Can you go and see your family doctor, or can you go straight to a consultant such as yourself?
Thank you for that question. So, the healthcare system that we have here in the UAE, at least, you have the luxury to actually just, pick up the phone and actually book an appointment with me. Exactly. But, also referring to whoever doctor you want, someone, you actually see, talking about the symptoms and getting a guidance of whatever specialty you'd like, and they can also, steer you in the right direction. But definitely in the healthcare here in the UAE, we are fortunate to have access to consultant and subspecialist, even if, you need us or you don't.
And if we have this conversation, Dr. Marilyn, in kind of 5-10 years' time about the latest advancements and approaches when it comes to your specialty, what are your predictions? What kind of topics do you think we'd be discussing on, the eye on health of the future?
That's a tough one, because we keep, this is one of the hot topic right now in my specialty, right? So every day there's literally hundreds and hundreds of articles coming up. My field is like evolving as we speak, really, and it's really hard to keep up. So the way I see it, I think we're going to be even more subspecialized. We're going to have lots of I hope we would be applying precision medicine much better. It's quite challenging in the fast moving or fast pace that we usually have. We're seeing patients very quickly, lots of patients. So I wish for my specialty at least to grow. There's only literally like 5 board certified allergists in Dubai. So hopefully I'll see more of my peers in Dubai. So yeah, lots of challenges, but really exciting times for us allergist immunologists.
And lastly, in that kind of near future, when you're looking at trends coming into clinic, you're looking at things that people are reacting to. Are you noticing any patterns, any trends that perhaps we need to be tuned into, whether that's in children, adults, or of course we've got an aging population in Dubai? Are you thinking, oh gosh, it's another what case right now?
Yeah, so that's a very good question, Helen. So for a reason or the other, I do see a lot of people with urticaria in the UAE. So urticaria is this condition where you get hives, you're itchy. So I see this in kids and adults, mostly in adults. We are seeing more asthma. We are seeing more nasal allergies. And that's because of, the whole, now that we have the COP28 also, it's because of all the climate changes, the pollution increase. All of that is actually making allergies worse and more prevalent. So that hand in hand, we're seeing more allergies. We're seeing more allergy symptoms, but not truly allergies.
Oh, that's interesting. It's so confusing. What's an allergy, what's an intolerance, and there's a lot of misinformation out there, which goes to show we need to go come and see you.
Simply put, when you have an allergy, your body is actually producing a protein against a specific trigger, okay? And you really need to avoid this trigger, otherwise you're going to have an immune reaction leading to severe symptoms such as rashes, nausea, vomiting, diarrhea. You can even have also blocking of your airways. When you have an intolerance or you're sensitive, let's say, to an irritant, to perfumes or irritant, you get the same symptoms of an allergy, yet you are not producing this protein I'm talking about. So when you have allergies and you have that protein, there's actually potential solutions for this. There's a cure for that. And we do something called desensitization or immunotherapy. But when you're just sensitive and triggered by these things, unfortunately, there is no permanent solution, and we can just, manage your symptoms and try to keep them at bay.
Recognizing it and moving forward with that knowledge. Dr. Marilyn Karam, thank you so much. It's been really interesting to think about what's happening now. And indeed, maybe we'll have a chat in the future and find out what's going on. But in the meantime, really, really appreciate your time. And you can be found, as I said, at Saudi German Hospital's consultant allergist and clinical immunologist. Wishing you a wonderful, wonderful holiday season and a very happy and healthy 2024. As I say, I hope to see you soon, but not in a professional capacity. Thank you.
Thank you, Ellen.
Really appreciate it. Next, we're going to be talking about taking care of your kidneys. And is kidney disease on the rise in the region? That's next.
You're listening to Eye on Health on Dubai Eye 103.8.
With MedLab Middle East. Register for free until the 7th of January at medlabme.com.